My name's Ejnes. I'm an internal medicine physician in community practice for, getting close to 34 years now. And I'm also a member of the Foundation Board of Trustees and the ABIM Board of Directors. And we're going to spend some time trying to get a better understanding of the ecosystem of misinformation, and then talk about how we can live in a world where misinformation will continue. Yes, I know, you're shocked, you're hoping it might go away, but it's staying, and we have to figure out how to live with it. So helping us out with this is Joe Smyser. He's the Chief Executive Officer of the Public Good Project. His academic background includes a PhD and Master's in Public Health and a postdoc at the U.S. Centers for Disease Control and Prevention. You can read more about him in the app. So I see, I'm looking down here, and I'll be looking at the screen down here in case people are wondering why I'm staring at the floor. And I see Joe there. Joe's in Washington. And let me thank him for making this possible and turn it over to him.
PGP's been running large-scale media monitoring programs for different public health topics for a while now, back to 2017. That was work I had started in my dissertation, my public health dissertation, back in 2008. At the time, it was the first dissertation that my committee and I were able to find that used really sophisticated media monitoring systems to track conversations related to public health. So I've been in the space for a long time, very long in terms of public health. And we were, when I took over PGP, which is how we refer to the public good projects, we started doing media monitoring right away. And that was not driven by any concerns around vaccine misinformation or disinformation. It was actually driven by just a desire to understand public discourse around prioritized public health topics. So these days at PGP, we track over 15 public health conversations, and conversations about vaccines are one of those conversations, but we also track conversations around substance use, mental health, domestic violence, even things like tobacco products or sugar-sweetened beverages. It's a whole range of topics, polio. So when there were measles outbreaks in 2019, if you can remember back to 2019, that was what we were all most concerned about in the world of health misinformation, because local health departments had gone in to try and discover what was fueling these measles outbreaks. And what they discovered was it was fueled by disinformation, deliberate spreading of false information about vaccines. So individuals were actually going into communities and handing out leaflets and actively trying to convince people not to get immunized. And that led to an interest in public health to discover, well, okay, where are these talking points coming from? How are they distributed? And is there any way to mitigate this? So we built the United States' first system tracking vaccine conversations. And then within that, we uncover a lot of misinformation and disinformation. That's called Project VCTR. It was funded by New York State Health Foundation and National Governors Association. And then later on, it got funding from CDC Foundation. So that's the system, regardless of whether you're aware of it or not, that actually fuels a lot of the journalism and a lot of the public health alerts that go out across North America. It's also the system used by the Canadian government. It's free. It's free for anyone who works in public health or healthcare or journalism. So if you go to projectvctr.com, you can actually get a login. But all this work is part of a larger story. That's why I was interested in joining you all here today. I know that you all look at this from your own perspectives, and some of you work in large organizations, some of you are in private practice, but you're all looking at the same thing I'm looking at. My perspective is somewhat unique in that I literally am sitting in front of dashboards every day. And those dashboards, it's hard to understand the scope of it if you've never done this work. But if I can paint a picture for you real quick, these dashboards suck up all public media data. So that means any public social media post. It means all traditional media, television, radio, magazines, newspapers, blogs and websites, online video like YouTube videos and Vimeo. All of that gets brought in through various means into a system that uses artificial intelligence to organize it all for me and for my staff, for anyone who does this work. The science is creating a query, just like when you go to PubMed and you're searching for a peer-reviewed article, or you go to Google and you're searching for a particular topic. We do the same thing. So we create very long search strings that surface conversations that are occurring publicly. And then the science continues. Once that is all presented in front of you, then it's categorized. So you start putting things into themes, and you start understanding the context in which conversations are occurring. So having done this now for a very long time, I can say that things are worse now than 2019. Things are worse than when there was public acknowledgement of the problem. So the Surgeon General's advisory, all of these high-level meetings that we've all had, the congressional hearings, none of it has done anything to mitigate the effect of misinformation and disinformation. It hasn't lessened the amount has actually increased. And what we've seen is the politicization of misinformation. And that, of course, has added fuel to the fire. It's made things exponentially worse. So we released a report a few months ago that was called "The Call is Coming from Inside the House." The reason we released that was nobody had basically given a name to the problem. The name to the problem is our country. So I'm an American citizen. I worked in government, as you've heard, I've been in public health for 20 years. It's very terrifying to me to look at these dashboards and see that across any topic that we monitor, not only is there more misinformation and disinformation than ever before, but there is massive distrust and disillusionment with healthcare and with public health and government in general, expertise in general. And I often feel like a climate scientist because I see these things before they're picked up in our surveys, before they're picked up by the traditional means that we keep tabs on what the public thinks or what the public does. So I can tell you right now, things are going to get so much worse than they are already. The presidential election cycle that's coming up is going to exacerbate all the fissures that we already see in society. So I think a lot about what can be done to make things better, what can individual healthcare professionals do in their own practice and their own lives to make things better, and then what could we potentially do as a society to actually really address the issue. Not more white papers, not more working groups, but what could we really do? So that's why I feel like a climate scientist often is I am looking at all these variables and I am seeing that they're all going in the wrong direction, and I'm feeling like I'm losing my mind because no one's really acting. So that's sort of setting the stage for you all, and then I came prepared to answer questions and have a good dialogue, have a good conversation. But that's sort of where I'm coming from is I just don't see any indication anything is getting remotely better, and I'm not seeing any actual mobilization at the scale that it would need to occur to make things better. So you all play a really important role in this. We all do, and I'm just happy to be here with you all today.
Well, thank you. I think that means that for the break, we're going to have to roll a bar into the back of the room there.
Sorry.
So, and a question, a lot of the work you're doing is in electronic media of various sorts, social media, blogs, online journalism. And do you have any data on what portion of the U.S. population actually gets their information through those means? And if they don't, where do they get it from?
Yeah, I think it can be confusing if you've never used these tools before, and almost no one in public health or healthcare has. I'm using a computer to access media data that is both online and offline. So if you follow this space at all, it can be confusing. It changes very quickly. It changes as fast as the media landscape changes. But you may have heard terms like social listening or media monitoring. We don't just track social media, so we're actually tracking broadcast television and radio and newspapers and magazines. So in the sense of, is our data skewed? No. I wouldn't say we're biased toward digital or not, but that the reason for that is we take it into account when we're looking at the data. So we use, our organization, and I think it's best practice, uses multiple media monitoring systems. We also have agreements with media companies where they give us their data. And so it's all about triangulation. The truth is out there, but the truth is rarely available from one source or one data set. So we spend a lot of time internally looking at what these systems give us, and then human expertise takes over, and an editorial perspective has to then factor in, and that's what produces any sort of public communications or misinformation alerts that we send out. These tools are really just like using SAS or SPSS or any kind of disease surveillance system. They are extremely helpful and important, but they do not get you all the way to your answer. It still requires investigation and study and a lot of practice and expertise. It takes us 3 months to get a new staff person to the level where they can even understand what they're doing. With these systems, then it takes about 6 months to get them to the point where they're proficient. And that is not at an expert level. So I would say, to give you an example of why even your perspective of digital media it may be inaccurate. There are companies like Dataminer out there who monitor all public communication generally, and then send mostly through digital media, like social media, and they send an alert to every major news organization in the world that this may be of newsworthy value. So there's a conversation occurring in Omaha about a car accident, and we've detected that not because we're in Omaha, we might be in Brussels, but we see the spike, we see that there's an incident occurring in Omaha, and the news organizations in Nebraska have hired Dataminer to provide them alerts when anything happens. That's actually how news occurs in the United States and many other countries now, today, is that it signals from varieties of media data that inform the news that you see on Fox 5 when you're, I don't know if that's an actual news station in Omaha, but whatever your local news station is in Omaha, the American public does not have a lot of media literacy, and certainly that lack of media literacy extends through public health and healthcare. It's not something that we're taught in our university training, and so there's just a big general gap in knowledge in how news and information is actually created and put in front of the public. And so whether or not you're on social media, you all are on social media, whether or not you're aware of it.
Well, that's helpful. And actually, this might be a nice opportunity because you listed a lot of things to do and tasks to try to get the information. And just this past week, a tool for people in this room and in the ABIM Foundation community to get that information delivered to them regularly was launched. So could you tell us a little about the newsletter?
Yeah, so this is exciting for us. We've been talking with ABIM leadership now for a few months, and I really want to give ABIM a lot of credit because this is a divisive space and it is not a fun one to be in. These are challenging times, and this is one of the reasons. This topic is one of the reasons these times are so challenging. Labeling something true or untrue or of questionable origin, it used to be just a basic function of journalism and public health. And today, even labeling something that's demonstrably false will put a bullseye on you, and you will receive a lot of negative, nasty attention. And there's lots of reasons for that that we could go into, but I think we all understand that that's where we're at. So ABIM and PGP have partnered, and what that means is at regular intervals, there will be a newsletter that goes out by ABM, and in that newsletter, there will be some information about concerning conversations that PGP has picked up through our media monitoring. And how we alert you to that information is we'll tell you what's going on, we'll summarize what we're seeing. We often provide a fact check, additional resources, occasionally talking points. We try and provide as much information as we can so that it's not just information, there's something you can do about it, something that will help you think about it and turn it over in your own head. And so the first one just was released this week, and then there's more to come. And this is all this is an attempt to distill the billions of data points that are swirling around the media landscape every minute of every day, to take all that and all that expertise that exists right now and distill it into maybe 5 things to know today that you may hear out and about in the world, or when a patient comes into your practice and asks you questions. How we do this work is, if something is important enough for us to write it down and include it in an email, it is typically because it has already been seen by many millions of people and is demonstrably false. It goes against the weight of evidence, which is how journalism functions. That's a central tenet of journalism, is what is the weight of evidence. And then our job is basically to contextualize that, put it in front of you, and then for you to take that information and do with it what you will. So you could think of this as an output of a disease surveillance system. The power is, information is certainly power, but it is an attempt to empower you to use this information in whatever way you need to.
Yeah, we can get people information on how to sign up for the newsletter, but to your last point, so I think about this as a clinician. I order a test, I order it on something that I can take action on the condition I can treat. And sometimes I'm not so sure that a lot of the information that's coming in relating to misinformation is easily actionable at the individual level. And we talk a lot about what institutions and society can do. What thoughts do you have for someone in my situation who's seeing patients 4 days a week, one-on-one, or folks here who may be community health workers, social workers, or other members of healthcare teams, and how can we use the information from a newsletter such as this?
Well, I always try and remind myself, I always try and take a step back and not get too caught up in the swirl. So we have a swirl of misinformation and disinformation and just lots of information in general. It's all overwhelming. But not to lose sight of what we've always known works. The things that we have always known still work today. And I would argue are more important than ever, because remember that everyone feels untethered. We have not processed our trauma from the pandemic, both as healthcare professionals, as health experts, but I'm talking more about just everyone. No one has had the space to deal with what we all just lived through, and it is now a generational trauma, and it just happened. No one can afford groceries. No one can afford to buy a home. No one feels secure in their job. Everyone's pissed off at anyone in any kind of leadership role. So that's the context that all this is occurring within. And what we see in our data is, if you're looking for me to tell you what kind of information is sticky, what do people respond positively to most of the time, it's information that is local and information that is personal. So a story or information about what is occurring in my town will always do better with the individuals who live in that town than a national level story. There are some challenges there because we have our local journalism in the United States and our local public health departments have been absolutely gutted. So most of the narratives that people are exposed to continue to be national narratives. But if you take that thing that is true, that if it feels local and personal to me, that will resonate more deeply with me, that certainly also applies to health communications. And it certainly also applies to the one-on-one conversations that a healthcare provider or healthcare professional has in the community. And then the role of a healthcare professional in their community. Because we all feel so untethered, we are looking for people who appear to be normal and measured and kind and thoughtful, because nothing around us appears that way anymore. So what we see in our data is just a massive hunger for authenticity and honesty. And that comes through in every single topic that we monitor. People are desperate for a connection, and they're desperate for the people who say that they know what the truth is or say that they know what the facts are to connect with them on a human level. And that's been driven by many things, but certainly chief among them most recently is the pandemic. So yes, there are techniques like the 3-5-3 method for communicating about vaccines with patients or anything with patients. There's the presumptive recommendations method recommended by CDC. I'm assuming you all have heard about these things, but when I see those things, the thing that sticks out to me most is, are you showing up like a human being? And are you keeping in mind the context that this person is emerging from? And if you can do that, that's 9 times out of 10 going to work. It's going to work better than anything else. And yes, we could talk about specific ways to talk about misinformation and disinformation, ways to arm yourself, to prepare yourself for those conversations, even different sorts of resources to share with patients or community members or community organizations. But if you just remember to show up with a sense of humor and empathy and an ability to listen, that will bring you so much farther than anything else I could possibly tell you. And that is often what I hear missed in forums where we are talking about misinformation and disinformation. It is we focus so much on the how, and we forget about the why. So that's just my personal feeling, but it feels very real to me when I'm looking at billions of conversations, and a common thread through all of them is experts in health have left us. They don't care about us. Their lives are not our lives. They have no idea where we're coming from. And now they want me to get a vaccine, but I can't see a doctor. I'm lucky if I see a doctor 1 time a year. And if I do, I'm going to get bankrupt. So why am I showing up to take this vaccine? The vaccine represents healthcare to people. So no wonder it represents mistrust. Yeah. So again, just centering ourselves and remembering what is needed for people right now. How do you show up for people in general right now?
And thank you. And a recurring theme just through the several hours we've spent together at this conference is the relationship. So it circles back to the relationship. One other hopefully quick point before we open up to questions. I was intrigued by the title of your paper, "The Call is Coming from Inside the House." And I was reminded of the Walt Kelly quote from the Pogo comic strip in the 70s. We have met the enemy and he is us. And a couple of threads on that. One is talking about relying on allies and the public health community, yet in one state, the public health community is part of the problem. The Department of Health's chief officer is promulgating misinformation. And then a second thread is many, hopefully most physicians feel that we have a role in combating misinformation at its source through taking self-regulatory action, be it changing board certification status, professional society membership, licensure. So I think the first point was probably just an observation. The second would be a question of How effective do you think that is, and are there any unintended consequences of, the profession taking action, doing the right thing on its own?
Well, so according to our numbers, so we're an interesting organization because we track all this stuff domestically, but we also track it all internationally. So we're UNICEF's partner on health misinformation as well. So we've done this work in over 50 countries. So that means a lot of data, but it means you start to get a picture of what's really going on. So in that report that you're referencing, what we found was over 70% of demonstrably false information about vaccines. So this is not a debate. These are things that you could fact check and find very easily are not true. 70% of that stuff that's all over the world comes from within our borders. It's not coming from Russia. It's not coming from China. It's not coming from Iran. It's not state-sponsored disinformation. That's out there, but it's actually just homegrown. It's our homegrown stuff. It's our homegrown nonsense. And that's what it used to be. In 2019, this was a problem of a global network of homegrown radicals who didn't trust government. And that was worrying, but that's not what it is anymore. We can't pretend that that's what it is anymore. It's not homegrown people concerned that vaccines are causing autism. Those people are been swept up and now a political movement. So Kaiser Family Foundation now says that the number one variable to predict vaccine acceptance or vaccine confidence is the political party that you associate with. The number one variable, more than any other demographic variable. And they're saying that because they're looking at their own polling data, and they're saying that when anytime anyone indicates that they are a Republican, they are in a statistically significant manner, more likely to be against vaccines, including routine childhood immunization. I am not against Republicans. I am not against anyone. But I think we are not having an honest conversation yet about the fact that our society is being ripped apart by the very institutions that govern our society. Depending upon your browser history, the second or third result in your Google search results, if you search for mRNA vaccine safety, is the Florida Department of Health's website saying mRNA vaccines are inherently dangerous. That's the third result. So if you expand that out to a global perspective, all of the stuff that we are producing that is vitriol, it's nonsense. It's for profit, politics, or power is what's driving it, not the truth. That stuff ends up in every corner of the world, regardless of whether they're using social media or not. And it happens lightning fast. What we see is when a senator here or a health director here, anyone, spouts off nonsense for their own reasons, it gets to rural Ghana, it gets to rural Indonesia in 24 hours. And so it's a global problem, and we have to the solution starts at home. It starts whether you care about what goes on inside our borders or whether you have a global perspective. It's really, really urgent that we address this stuff. So that leads me to your second question. I think we are really at a turning point in our country. This is me speaking for myself. I wrestle with this every single day. What is my role as a scientist? What is the role of our institutions? I think you have to take a stand now. I think this culture war is already going on, and you have to decide in what way what you are comfortable with, because some of the decisions can take a massive personal toll. I've been threatened with many, many acts of physical violence. And I've had people show up in real life outside my home and show up and threaten my mother in real life. This work, if you do it, and keep in mind, all I'm doing is just tracking public conversations and informing public health. But I'm cast as a villain, and that isn't going to increasingly happen. regardless of what occurs in the near future. So a medical board saying, we are going to take the radical viewpoint of just affirming that there is truth is unfortunately going to be a very divisive statement and going to put you in the crosshairs of a lot of vitriol yourselves. But I don't see an alternative. You can be quiet and you can just get swept away in the current of all this. But I think that's just delaying the inevitable. Intelligent people, trained people, expert people. We are living through a fundamental change in how society works. If you feel like the ground has shifted underneath you, it's because it actually has. If you feel like nothing's normal, it's because nothing is normal. So you have to decide how you personally are going to fight back against that. So yes, I encourage more organizations to do what ABIM is doing and what others are doing. And I say that knowing full well the cost of doing that. But what is the cost of not doing it? Mm-hmm. It's so enormously bad that I think we have to do something.